I'm Jennifer Burke. If you're one of those people who feel anxious in social situations or scared to start up a new project, there is actually a new anti-anxiety app called Anxiety Coach that can help. The app, which was developed by the world-renowned Mayo Clinic, is just the latest in anti-anxiety apps to hit the market. The purpose of the app is for people to overcome fears and worries, from extreme shyness to panic attacks. Here to talk about this new way of treating mental illness is Dr. Katy Kamkar. She's a clinical psychologist from the Center for Addiction and Mental Health. Dr. Kamkar, thank you for coming on today.
Thank you.
Have you heard about these new anti-anxiety apps, and what do they actually do?
Yes, absolutely. I have heard about it, and they do help in terms of monitoring the symptoms of anxiety, in terms of having essentially a better understanding of the symptoms, better monitoring the symptoms, and really identifying an individualized goal, individualized plan to really confront the fear situations.
When I heard about this story, I actually thought it was a good idea because from doing some research, I sense that people who are in those moments of anxiety, if they could use this technology, would it help them at that particular moment, or does it depend at what level of anxiety you suffer from?
It does. So it is definitely helpful, again, in terms of, raising awareness of the symptoms, definitely monitoring the symptoms, monitoring also the severity of the anxiety. But whenever anxiety ranges from moderate to severe in terms of the severity level, it's very important to seek professional help in addition to this tool. We know that anxiety disorders really as a group are one of the most common mental health problems, and actually anxiety disorders about 12% of population suffers from anxiety disorder. So really this is 1 in 4 Canadians who suffer from an anxiety disorder. So it's also a disorder that does contribute to tremendous amount of disability and suffering. So it's very important to seek professional help. In addition to, we can also definitely use this app as a complementary method.
Sure. Now, it seems like anxiety is more prevalent in our society. You say 1 in 4. Is that on the uptick, or are more people just willing to talk about it?
It's really both. We know that the stigma attached to mental illness is still a significant barrier. 2 out of 3 people who do suffer from mental health problems do not seek help. We are definitely much better than we were years ago, decades ago, in that there's now more open communication. People are now more willing to talk about mental health problems and how they're suffering. There's still definitely more work to be done, but it does remain a problem.
This anxiety app, what would it be offering people? Just suggestions on how to breathe properly, or what are specific things people who suffer from mild anxiety could do with the help of an app?
I believe that the approach that they use really come from the cognitive behavior therapy. So evidence-based CBT has been found to be one of the most effective treatment for anxiety disorders. And it does include identifying the triggers to anxiety, the symptoms, monitoring the symptoms, and really one of the key components of cognitive behavior therapy. So one of the key components of CBT is exposure intervention. So really gradually confronting the fear. So I believe this app does include that in terms of monitoring the symptoms, the anxiety level, and also setting up individualized goal and really gradually confronting the fear. But again, depending on the situations that are avoided, depending really on the severity of the avoidance, the severity of the anxiety, it will be usually recommended to use this tool in addition to seeking professional help. But the methods that are used are derived from a cognitive behavior treatment.
Fascinating. Dr. Katy Kamkar, thank you. Appreciate it.
Thank you.